My name is Ernesto Guido. I am a neurologist with CHRISTUS Trinity Clinic. My hometown where I was born is a little town deep in the hills in my hometown, El Salvador, in Central America. And that was where I grew up. My childhood was very unique because I was very, very close to Mother Nature. Perhaps my biggest influence was my mom, my mother. Number one, because she was the one who encouraged me to go into medicine, but more than that, I saw her suffering of a very severe neurological problems when I was in my teenager, and that pushed me even more to go into medicine, but particularly to also go into neurology because she did suffer of a neurological problem at that time. Again, the main influence was my mom, and later on in my life, I did suffer myself of some issues in health, something that may look so trivial at this point. It was a minor thing. I did have a Bell palsy when I was again in my late teenagers, and that also made me to think about part of the neurological issues because my face was crooked. I was suffering so much. So that was another type of influence for me to go into search a little bit into more medicine type of profession. Well, it's the challenge. I always was interested in finding answers and being working as a detective. And really, medicine, but in particularly in neurology, is a profession that you had to search and find the answer of so many puzzles, so many signs and symptoms. So you kind of work like a detective, and that's kind of give you a rush, a feeling that you're going to find some answer on all these important points that the patient is confronting with, and you have to find the answer as a detective. My philosophy in commitment of patient care is what we call a holistic medicine. And through the years, in my specialty, I have been striving and educating myself in trying to find a balance in medical care, particularly in regard to alternative medicine. And in my last several years of my training in nutrition, holistic nutrition, I believe that we're missing a lot as a professional, and we don't treat our patient in a whole way. We just go and treat things, symptoms, when we have to treat the whole person, the whole soul, the whole spirit, and encourage them to improve themselves. There's so many things that we're missing in our patients that we're not doing. That is my philosophy in my patients.